Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So today we will be seeing about inventory control and condemnation. So I have already posted a video regarding the material management. I will attach those video in the last of this video. Kindly have a time to watch it. Here we will discuss about each and every analysis. In the previous video what I have posted in material management, I have discussed only about ABC analysis and WED analysis. So now in this inventory control video we will see in detail about many other analysis and also the condemnation process. So before proceeding into the videos, we must know as a nurses we follow the inventory control register. That means how much medicines are being stored, how much gauze pieces are there, how many life-saving drugs we are storing, how many equipments we are having in a particular ward. For example, how many ventilators are there, how much cardiac monitors are there. Like that we have a inventory control. That means count of each and every equipment and articles in the particular ward. So why we have to maintain is then only we'll come to know if it is needed for the future uses, either we have to procure the items or whether it is not at all needed to procure. So for example, in our home also what happens, so monthly we used to buy the groceries. So depending upon the stagnation of the materials we will buy the products. For example, a particular powder is being stagnated in the home. So what our mother will do, she will not buy that particular powder in the next month. So she will think that already it is there, it is being stored in our home, it is need not to continue the same procurement of that particular powder. So this is being correlated with the medical professional also. For example, I am going to buy any particular drug means I will see the inventory register that particular drug is available or not. So according to the stock level, 5 numbers or 50 numbers or 100 numbers, if it is there means I will not again procure that particular articles or equipment. So based on the need of the present situation we will do the procurement. For example, during the COVID era and all, there was a shortage of the O2 cylinders. So depending upon the need, what happens, the healthcare organization has done the procurement of the oxygen cylinders because there was a much demand. So that is in simple term known as inventory control. So we'll see in detail. Inventory control means stocking adequate number of kind of stores so that the materials are available whenever and wherever is required. So inventory control in hospital is more than that just procurement and usage. So just the right amount of supplies needed for patient cases while tracking cost, pricing and patient charges associated with supplies. This has to be done at an optimum outlay of financial and human resources. So during the intending of any materials, for example, a patient has undergone a particular surgery. For that surgery, the instruments have been used, number of gauze pieces have been used, Gamgee pad has been used, suture materials, everything. So whatever the materials is being used for that particular patient, that only will be given as a intent. So without any use, if you are intending on that particular patient, what happens, the patient has to pay extra money on the equipments or any needles or sutures what we are intending. So depending upon the need of the patient we have to do the inventory. So definition, inventory control is a scientific system which indicates as what to order, when to order and how much order and how much to stock so that purchasing costs are kept as low as possible. This definition is given by Jogendrawati. So when, how and how much to order is in simple term known as inventory control. So objectives are to supply the materials in time, to give maximum client service by meeting their requirements timely, effectively, efficiently, smoothly and satisfactorily, to reduce or minimize in inventories, to minimize idle time by avoiding stock out and shortages, to minimize the losses due to deterioration, damage of stock, to meet the unforeseen future demand, to average out demand fluctuations, to balance various inventory costs such as carrying cost, order cost, etc., to avoid the shortage of stock. So we as a nurse manager we have to be very conscious in procurement out of each and every articles, equipments or supplies because it has to meet the future need and also the present need. And also If we are just only procuring, we don't have the control over the items what we have procured. What happens is it gets stagnated in the storage area. So what happens, one is storage is waste of time, material is waste of time, manpower is waste of time. So depending upon the need, we have to do the inventory control. Next is importance of inventory control. To provide a maximum supply service consistent with maximum efficiency and optimum investment. So whatever we are doing the investment, that has to be for the need of the patients. To have an optimum level of inventory, not too large, not small. That means whatever we are having the procurement, it has to satisfy the present need. So it should not get stagnated for a very long time, and also it should not go as a out of stock very quickly. To eliminate duplication in ordering. So for example, if we maintain the inventory register or inventory control only, we will come to know that this all material is already intended. So if we are not having that inventory register, what happens? There may be a duplication of materials. So if there is a duplication, then the stagnation of materials will get in the storage. Next, to minimize the waiting time, to facilitate the cost accounting activities, to better utilization of stocks available, to take care of increasing price tendency of commodities or rebate in bulk buying. So essential principles of inventory control is right items. So for what purpose we are procuring, so we have to procure that particular item. Right quantity, right price, right source, right delivery, right method, and right people. So right quantity means how much quantity we have to procure. For example, I am going to have a procurement of the X-ray machines. So if I want 1 or 2 or 3, so depending upon the need, we have to procure the items. And also right delivery. So at the right period of time, we have to maintain the delivery of the products. That time is known as lead time. Next is right method, in which method we are going to have the procurement, and for the right people. So for example, during the COVID times, we want more number of masks, O2 cylinders, personal protective equipment. So based on the need, for what purpose we are procuring and for what people we are procuring. So these all comes under the principles of inventory control. So types of inventory cost is, one is ordering cost. So if we are going to, we have planned about ordering of particular equipment. So then that will have a ordering cost. Inventory, that is carrying cost. Out of stock or shortage cost or other cost. So ordering cost means cost of ordering the item and securing its supply is known as ordering cost. So salary of wages and store personnel, everything. So inventory carrying or holding cost means this is the cost incurred for holding the volume of inventory and measured as a percentage unit cost of an item. So it includes capital cost, obsolescence cost, deterioration cost, tax or inventory. So how much we are carrying, that is known as inventory carrying. So shortage cost means it is a loss which occurred due to the non-availability of the materials. For example, we have ordered the materials. So if it is not delivering the particular equipment at a specified time, what happens? That is known as out of stock cost. Next is concept relevant in controlling inventory control. One is periodic and cyclic system, two bin system, lead time, minimum or buffer stock, maximum order level. Next is reorder level. So we will see this concept, that is periodic, two bin system, lead time, minimum or buffer stock, maximum order level, each in one by one. So first we will see the periodic or cyclic system. So this means that placement of order depending upon the stock on hand and rate of consumption. The ordering interval is fixed, but the quantity to be ordered varies each time. So for example, I am buying gauze pieces of about 50,000 in the particular month. So next month it may increase or decrease depending upon the item. But whatever I am going to do the procurement is same, that is gauze. Next is two bin system. I will be having a two bin. One bin will be very large, which consists of whatever the equipment I am having will be stored there, articles. Next is lead time. That means it is the average number of days between placing the order and delivery of the order. Next is minimum or buffer stock. The amount of stock that should be kept in reserve to avoid a stock out in case consumption increases. So that means that we have to have a minimum or buffer stock. Minimally, I should have this much amount of medicines. So if it is getting reduced means immediately I have to do the procurement of the particular items. That means safety stock equal to maximum daily consumption minus average daily consumption into total lead time. So maximum order level means this is the maximum quantity of materials to be stocked beyond which the item must not be in delivery. So for this much only there should be I have to procurement. For example, I have to procure of about the life saving drugs. For example, I am going to procure the adrenaline about 100 medicines. Means that is the maximum stock that has to be buyed. Next is reorder level. So reorder point is a sum of safety stock and quantity used during the lead time. So there will be a time between the ordering and the delivery, that lead time we are just having means that is known as reorder level. Annual consumption is high order are placed frequently, and that is known as for amount of annual level we'll do the procurement of any instruments. Next is process of inventory control. So first we will plan, then do the procurement, then receive and do the inspection of that particular instrument. Next, storing and issuing the inventories, recording the receipt and issuing of inventories takes place. Physical verification done by the biomedical team. Follow-up and functions will be carried out. Then material standardization and substitution will be done. For example, already in the ward I am having a ventilator which is not been working. So I have to do the substitution of that ventilator by the new procurement of the ventilator. So that is known as planning. Next is then I will do the procurement of that particular ventilator machine. Then I will receive and do the inspection of that machine. So this all is the process of inventory control. So techniques of inventory control is item quality, quantity, price value. That is I will do the analysis between the 2 to 3 members. Then I will do the price analysis and procure the items. Next is source, from where I am going to procure the item, market research, or what are the technique I am going to do for the purchasing. Next is delivery time, method of doing the procurement. Next is inventory classifications. So that is ABC analysis, VED analysis, HML analysis, XYZ analysis, FSN analysis, SDE analysis, Gulf analysis and SOS analysis. We will see about each and every analysis one by one in detail. So ABC analysis is always better control. It is a process of classifying items using a value and measure. So A items are smaller in number due to their high cost items. So for example, ventilator machines, X-ray machines, these all are very high cost orders. So we will have that materials in very less quantity. So scope, for any surgeries we are doing the laparoscopic procedures, for that laparoscopes and all, it will be very high in amount. So we will be maintaining those items in very less quantity. Next is strict and close monitoring will be done for this materials for X-rays and ventilators. Next is item consume major portion of the fund. Next is B items, moderate control, purchase based on rigid requirements. A strict watch and control will be done. Again it is a moderately maintained. And C items are large in number, consumes a less amount of resources. So the inability of these will not cause any difference in the organization. So next is VED analysis, that means vital, essential and desirable analysis. So vital means without which the hospital cannot function at all. For example, oxygen supply. The E means essential, without which institution can function but the quality of rendering the services will be not there. So for example, intravenous fluids. So D is desirable items, unavailability of which will not interfere the functioning of the hospitals. So it can be easily purchased and as when required, stocked very low or not. For example, the cough syrups. So next is FS analysis, that is fast moving, slow moving and non-moving. So classification based on the consumption pattern of the item or issue of the item. So STE analysis means scarce, difficult, easy to obtain. That is known as STE analysis. So this is a short supply managed by the top level management. So D means difficult items which are available, indigenous items come from distant places. Next is HML analysis, that is high, medium and low analysis. This is also a classification as a unit value of the item. So XYZ analysis means inventory value are high, moderate inventory stocks and inventory values are low. So Gulf analysis, government, ordinary, local, finance. Next is periodic inventory system, means a certain point in time such as once a month, quarterly, at the beginning of end of each year do not have accurate record of the inventories. So periodic inventory system means at the beginning of each month and each annual year we have to maintain this record, but most of the time these records are not maintained properly. So next, the important step is condemnation. So we have procured the items, we are using the particular equipments or any articles For what happens at particular point of time, the repair of that particular item is not possible. If it is possible also, the amount which is spent on that repairing is going to be in a high cost. So we will do the process known as condemnation. For example, I'll tell you the life experiences that I am having a particular refrigerator. That refrigerator has some expiry date, right? So beyond since it has expiry date, but the biomedical team has came and said me that the repairing of that particular refrigerator takes a much cost rather than you can buy a new refrigerator. So I'll think efficiently that repairing cost is higher than the buying cost. So I will do the condemnation process. So that is known as condemnation. That is removing the particular equipment or article from the institution. It is known as condemnation. So condemnation has various reasons for condemning, and it also, the budget planning also plans for the condemnation process, and also the condemnation is a last process. So each and every item have their own expiry date and their own functioning, whether it is obsolete or the cost of repairing, if it is high, we will do that condemnation. So we will see in detail about what all the procedures for condemnation. The materials which could not be used within its shelf life, deteriorated and declared unfit for use, became obsolete or banned due to legal provisions are considered for condemnation or disposal. So if articles become unserviceable, non-repairable and life expired out of the expiry date, we will do the condemnation. So need for condemnation. Why we need to do condemnation? To remove the stock and to destroy the unserviceable items, to remove the item from the institution, to follow the practice of clean and healthy environment. So if we are just storing the unrepaired items, not of use items, if we are storing, means what happens, it will occupy the major storage area and it is going to be time consuming and money consuming. Next is criteria for condemnation is the equipment has become non-functional and beyond the economical repair, non-functional and obsolete, functional but obsolete, functional but hazardous, that is it is functioning, but when I am using that particular equipment it is going to harm that individual. Next is functional but no longer required. So the particular equipment is functional, but for that particular ward it is not at all required. Either they will do the condemnation or they will do the transfer out of that particular article. So these all are the criteria for condemnation. So if any product or any equipment satisfies these criteria, these 6 criteria, then we will go for the condemnation process. So who will do this condemnation is the head of the particular department. So nurse means she will do that condemnation process. Next is only the items issued from the store and used in institution or wards and units will go for condemnation. So repairable items should not be condemned. So if at all a particular equipment is we can do the repair and use it, means you should not go and do the condemnation process. So depending upon the need and also the cost charge for repairing also, we have to keep it in mind. Next is details of condemnation should be recorded. For what purpose you are condemning, what is the expiry date, what is the cost while buying that particular equipment, and specification to be entered. High-end equipments including X-ray machines, refrigerators, etc. The expert opinion from the competent authorities required. For example, high-order items like mechanical ventilators or X-ray machines or the MRI machines. If we are going to do the condemnation, means before planning for condemnation, you have to call the biomedical team and you have to see that whether it is repairable and what the cost of repair will be there, whether we have to do the condemnation or not. From them we have to get the opinion, the authorization letter, then only we have to proceed for the condemnation. So procedure for condemnation is a condemnation committee comprising of 3 or more members. It is constituting that for what purpose we are condemning, they will analyze it. Next is to go in detail of the reason as why the situation has occurred, for what purpose we are condemning the particular equipment. The people who are responsible for the lapses on the aspects from acquisition to storage and distribution of materials. The committee will declare the items condemned and make the recommendation for the further disposable items. So the condemnation committee will analyze the particular equipment and see for what purpose the condemnation is going to take place, and all they will refer and scrutinize it, then they will approve the condemnation process. The effective measures are taken for disposal of surplus items. So surplus item means some of the items which is not going to be needed in a particular ward or institution, that is no longer needed, but it is in a good functional condition. So what happens is that the higher authority will decide to do the tender, and they will sell in the other institution which really need of that particular equipment. So that is known as the effective measures to disposable of the surplus items. The materials may be sold by the inviting tender. So they will invite the tender. So who is paying higher, they will sold out that particular equipment to that organization or institution. So the open auctions of items through authorized auctioneers will be done. So in even the homes and lands are, we are doing the auctions now. In the same way, the equipments in the hospitals will also undergo the auctions, and based on the tender we are receiving, if the tender is having high amount, we will sell it to them. Next is, what are the certificates we have to maintain while doing the condemnation is, like the biomedical person will come and give you the letter regarding that it is no longer functional and it is out of expiry and you can do the condemnation process. So especially for the high order machines like X-ray machines and mechanical ventilators. Next is certificate that the unserviceable items cannot be made serviceable, that and all. Next is certify that the I am assuring that the particular equipment is no longer needed. Next is role of nurse. So ensuring the regular and adequate flow of supply, a proper inventory control should be maintained in each and every ward, and inventory register should be maintained out to check out the stock in and stock out. So which comes first, that has to be gone first out. Next is arranging for the condemnation and articles, arranging and assisting in audit of materials, and proper procurement should be done. So only we have to plan accordingly, and we have to check the cost of the particular equipment, expiry date of the equipment, everything should be done. And the certificate should be received while doing the condemnation processes, like the certificate from the authorized persons like biomedical team and the head of the department and head nurses, nursing superintendent. So from each and everyone, the equipment which is related to, we have to get the authorization letter and do the next step of the repairing process or the condemnation process. Next is evaluating the efficiency of the materials management system. So next we'll see about the form. For example, this is the form that has been required, like from where it was purchased, what was the cost while buying that particular equipment, and what is the warranty period. From and to, we will see the warranty periods, and also the model, serial number of the equipment. So each and everything will be written in that particular certificate, and then we will proceed to the condemnation committee to do the condemnation. So they will analyze these paperwork, and they will scrutinize each and every step what we have done, and then they will see, and then they will analyze the certificates we have been obtained from each and every department. So then they will do the condemnation. So inventory control is a technique, the size of the inventory at some desired level, keeping in view the best economic interest of an organization. So not only we have to do the proper intending or maintaining the inventory register, but also the control of the equipment should be there. Then only what happens, we can save many resources, manpower, and also the waste of money can be avoided, waste of time can be avoided. So in order to meet the demand of the future terms, we have to procure the items accordingly. So already we have faced the situation in a COVID era, like we have to order the oxygen cylinders, mask and gloves, everything in a bulk orders, right? So depending upon the need and emergency situation, we have to do the proper procurement of the items, proper control of the items, and proper maintenance of the items. And after the maintenance, if it is needed for the condemnation, again the condemnation should be also taken in the proper steps. So far we have seen about the inventory control, what are the types of analysis, and next the condemnation, what are the criteria for condemnation, what are the procedure for condemnation, from procurement to the condemnation, what all we have to done, and what all the certificate we have to get. So that's all the video is. If you have any doubt, kindly drop down in the comment box. Kindly like it, share it, and subscribe the Nursing in Handy channel to have a continuous learning in your profession. Thank you for watching.